Dietitian Michelle is a registered dietitian in Nigeria, an expert with over 10 years in practice, a seasoned professional in diet calculation and planning, the co-founder of Citadel Nutrition Consult, author of several ebooks on weight loss and diabetes management, member of the British Dietetic Association, UK, member of the Nutrition Society of Nigeria, holder of certificate in diabetes care from the University of Warwick in the UK, holder certificate in exercise prescription for the prevention and treatment of disease, Trinity College, Dublin, holder certificate on nutrigenomics for professionals of nutrition.
So a lot of people believe that dietitians are people who know how to cook so well or know how to mix one type of food with another just so you can stay healthy. Well, on the Medical Nutrition Therapy series, we're going to be telling you what medical nutrition therapy is, what to expect during MNT, who should provide MNT, and diet plan as integral part of MNT. So, welcome to MNT series with Dietitian Michelle.
Thank you.
Okay, so it's good to have you in the studio. Yes, it's good to have you. So, what is MNT? That's my first question to you.
MNT, Medical Nutrition Therapy, is simply a nutrition-based treatment, and this is provided by a registered dietitian who is knowledgeable about medical nutrition therapy. Now, a lot of times, just like you said, people think that dietitians just know how to cook healthy meals.
Yeah.
Yes, it's part of it. It's part of what we actually do. It's called a modified diet, and in extreme cases for people who already have complications, it's now called therapeutic diet, a kind of diet that is not just to taste nice, but a diet that is aimed at achieving some health benefits. So yes, we actually do cook, but what we provide, our services, what we do is what providing medical nutrition therapy. Cooking is part of it. Counseling is not just what we do. We don't just counsel people, eat this, don't eat that. That's not what dietitians do. We provide medical nutrition therapy. And we don't just issue one diet plan for everybody. Oh, diabetic, this is what you need to eat. Take this diet plan. Type 1 diabetic, take this diet plan. Type 2, take this diet plan. Young diabetic, take no. That is wrong. In nutritional management, there is no one size fits all. It has to be individualized. And we don't just give general guidelines. We don't just give general guidelines and give you a food list. Avoid foods here, eat foods there. So dietitians provide what is called medical nutrition therapy. It's a treatment. It's a nutrition-based treatment with tangible results.
Okay, so I was going to ask you another question, but it seems like you're already, going into it. So what is the major difference between medical nutrition therapy and nutritional guidelines?
Yeah, nutritional guidelines that's why it's called guidelines. It's a generalized guideline for disease conditions. For instance, in diabetes management, a lot of people already know that in the management of diabetes, you should avoid refined foods because they are very high in carbohydrates, which is the nutrient of concern in the management of diabetes. But yes, that is general. You cannot measure results based on that. You cannot measure progress. You can't be specific on that. So in as much as nutritional guidelines is part of what we provide, medical nutrition therapy is specific. You know what should be achieved. You specify it. Okay, this person has type 1 diabetes. How much carbohydrate should I place him on? You're being specific now. And even when you come down to the quantity of carbohydrate, you justify it. Am I supposed to place this person on 180 grams of carbohydrates? We are not guessing. There's no guesswork here. There is no assumption. You're going to hit the nail on the head during this therapy, during this nutrition management. So you have to justify it. You have to spell it out. You have to name the diet. Oh, this person is on 180 grams of carbohydrates because he has type 1 diabetes. Or I am placing you on 135 grams of carbohydrates because you don't exercise, because you're not active. You can see, we are not just giving nutritional guidelines. After being specific about the diet this person should eat, then you will break it down into what we call diet plan. So you break it down, because you can't just tell the person, okay, you're supposed to be on 1,500 calories, or you're supposed to take 180 grams carbohydrate. Do they know what that means? No. So it's still our responsibility as dietitians to break that down into what do we understand.
Okay.
So you see, medical nutrition therapy is specific, unlike nutritional guideline, and it's measurable. The progress is measurable. You can measure it. For someone you're managing for sugar control, the person's glycated hemoglobin is high. What is the goal? How will you measure progress? That person's glycated hemoglobin should reduce by at least 1% in 3 months' time. So that's how to tell you that, okay, he's responding to the diet plan. He's doing well.
Wow.
So it's measurable. You can measure, is it weight loss? Okay, if you're taking 1,200 calories and you're taking 15,000 steps, you should lose 0.5 to 2 kg weekly. It's measurable. So if you check and you're not taking up to 15,000 steps, then you will know why you're not losing as much. So you can see, medical nutrition therapy is no guesswork. We're not just throwing stones in the air. We are specific in the management, and you also have ways of measuring progress. You're not assuming the outcome. So medical nutrition therapy is not the same as providing nutritional guidelines. Eat this, don't eat that. Anybody can provide that. In fact, you don't even need someone to provide. Just go to the internet
For nutritional guidelines.
Just type diet for diabetes, and you're going to see all nutritional guidelines. You're going to see a lot of things, but the question now will be, how much are you going to eat? Based on the nutritional guidelines, can you measure the amount of carbohydrate to eat? Can you measure the amount of calories? Do you know the type of carbohydrate to eat? Now we're talking about foods with low glycemic index. Do you know the ones you should eat? So that is now what the dietitian will do, and that's why we call it what medical nutrition therapy. It's specific, it's measurable, and it's provided by registered dietitians.
Did you know proper medical nutrition therapy provided by an experienced dietitian can help you control your sugar level, reduce your blood pressure, reduce high cholesterol, lose excess weight, treat cancer cells, restore kidney function, and gain weight if necessary? Do you struggle with any of the aforementioned? Then call to consult with Dietitian Michelle on 0904 675 8079. Again, 0904 675 8079. Or visit our website at www.dietitianmichelle.com to learn more.
Okay. So we're learning a lot. So having known some of the benefits of MNT, I'm going to ask you, when should MNT be implemented? At diagnosis or after complications arise?
It should be at diagnosis to get the best out of medical nutrition. Now, that does not mean that when there is a complication, medical nutrition therapy won't be effective. It does work. It's still very, very effective. Just that it's very, very difficult. And the diet, most times when there's complication, does not taste nice. It doesn't taste nice, because now your food is no longer just for you to enjoy, or you're not looking for nutritious foods. You're not looking for something to eat to get well. That's what we now call the therapeutic diet. Now imagine if you have someone who has diabetes and it now comes down with a kidney problem, and maybe cancer, hypertension. You can see a lot of complications.
Yeah.
You're not just looking for foods with low glycemic index. You're not just looking for foods that have low starch content. You're looking for foods that are also okay for the kidney.
Yeah.
So you see, it becomes a lot more complicated. The calculation to calculate that diet is a lot more complicated, and of course, the food does not taste nice. But if medical nutrition therapy is implemented on time at diagnosis, that is the recommendation. That is what WHO says. On diagnosis, as soon as someone is diagnosed with a diet-related disease, see a dietitian, so that complications can be delayed or even prevented.
Okay.
So let me even give you another instance. In the case of diabetes now, if someone is diagnosed with diabetes and the person is just started on medications like insulin or metformin, and the person does not get to see a dietitian, the person has a high chance or high risk of coming down with kidney disease very early. Why? Because seeing a dietitian who knows that metformin and insulin increases one's risk of having a kidney problem, what will happen? You will take some measures. You will adjust the diet. You will reduce some things and increase some things because you already know what this person is facing.
Yeah.
So you're not just going to achieve your results, which is what glucose control, but you're going to be preventing your risk of developing what a kidney disease. Why? Because the dietitian already knows. We put your health first. We check everything. We also factor in other things that won't even come to your mind as a patient, but because that is what we read in school. We read that, we studied nutrition and dietetics, we went for internship, and I have been counseling, I have been managing clients for over 10 years now.
Wow.
So based on experience, even I'll be able to know things to avoid, foods to take out of your diet, so that you can still enjoy your food and achieve control.
Yeah. Okay. So now who needs MNT?
Yes, thank you for asking that question, and it's very important because sometimes someone who has a backache can just call dietitian. And I tell them, please go and see your doctor. There is no nutritional management for that one. Some will even call me to say, oh, the fibroid, this one, what are the foods? I said, look, adequate diet is what we recommend for everybody. Just have a balanced diet, eat right. But medical nutrition therapy is not for all conditions. Is it fibroid? Go and see your doctor and listen to him. But there are some diseases called diet-related diseases, meaning that diet contributed in its development. So diet must be part of its management. And some examples, diabetes is a diet-related disease, and medical nutrition therapy is important. Without that, you can liken your treatment with throwing stones in the air and aiming at nothing. It will be difficult to achieve control. It's going to be a thing of trial and error. And before you know what's happening, complications will arise. So diabetes is a diet-related disease that requires MNT. Kidney problem is also a diet-related disease where protein intake needs to be regulated by the dietitian. So that also requires what? Medical nutrition therapy. Obesity, we also consider it a diet-related disease. Yes, obesity is a disease. That's what we call it.
Yeah.
It requires medical nutrition therapy. Even underweight people require medical nutrition therapy because your immunity is going to be weak if you're underweight. You need to boost it up and get to your right body weight.
Yeah.
Not just that, even anemia. Why? Because iron is obtained from food. So it's also a diet-related condition. High cholesterol, it's a diet-related condition. Hypertension is also a symptom that responds to medical nutrition therapy. Cancer, both prevention and treatment and management requires medical nutrition therapy. These are just some examples. All cardiovascular diseases require medical nutrition therapy. Sometimes even surgery for people who are overweight and need to undergo surgery, if they don't lose the excess fat, there might be complications. So that condition at that point will require medical nutrition therapy so that the surgery can become successful. There are many other diet-related conditions, but I'll just leave it at these that I have mentioned.
Okay.
Perhaps as a doctor, physiotherapist, or healthcare provider, you would want a dietitian with whom to co-manage patients who have underlying diet-related conditions, or one with whom to set up a medical nutrition therapy unit at your health facility. Dietitian Michelle is an expert with over 10 years experience working with patients and in partnership with health centers all over the country. She is a seasoned professional in weight loss, diabetes management, and diet planning whose simple and practical therapy methods has helped countless patients manage their health better. You can call 0904-675-8079. Again, 0904-675-8079 to contact her or visit www.dietitianmichelle.com for more inquiries.
So, before we round up on today's series, we're going to be taking a testimony from someone who has benefited from medical nutrition therapy. Good morning, Sarah. It's good to have you join us in the studio today.
Yeah, good morning. How are you today?
I'm very fine, thank you. You're one of dietitian Michelle's clients.
Yes, that's correct.
Okay, so we'll just want you to give us a very brief story on how your journey has been.
On medical nutrition therapy.
Okay, well, all I can say is that since I started with her diet plan, there have been quite some improvements overall in my health.
Okay.
You see, everybody has a notion of what is good or not good to eat. It's purely personal notions, and they are not, in most cases, they don't conform in most cases to the practices. Because everybody knows what they don't know.
Yes.
The relationship it has, what they eat has with their body, they don't know.
Yes.
Hello, sir. Can you hear me, sir?
Hello, can you hear me?
Yes, we can. Well, we seem to be having some network challenges, but we'll still want you to go on.
But you hear me now? Is it better?
Yes, it is.
Okay, so like I was saying, when I met her, there was this approach that was quite different from what I used to know.
Okay.
Giving me a list of what to eat and things like that. Avoid this, don't avoid that. But I think it was studied because it took into account the calories I should have a day, my weight and everything. And she came up with some plans.
Okay.
Because initially you don't like changing the food is quite good, so you like to eat what you love to eat. But after a while, and eating properly, you adjust to whatever she prescribed. And then it went on. After a while, I asked her, okay, you didn't put all the things I love to eat. So I named a lot of the things I like to eat. I said, now you walk and tell me what quantities I should eat. It turned out very fine. I'm still on the diet today, and I've tried to advise a lot of my friends to go into well-studied diet plan. Extremely important.
Yes.
Okay, you were saying?
Okay, I was saying you're advising your friends to have...
I've lost you again.
Uh-oh. Okay, so we lost our clients there due to network challenges, but I'm sure you have heard his testimony and how important medical nutrition therapy is. So that's about what we can take on today's episode of the MNT series. We do hope that you join us next time. It was good having you, Dietitian Mitchell, in the studio.
Thank you, Naomi.
So do have a lovely day until we come your way next time.
Citadel Nutrition Consult brings to you a premium quality plantain flour, Smart Mix. It is a unique blend of unripe plantain and finger millet for lower glycemic index, lower glycemic load, and improved nutritional quality. Plantain Smart Mix is rich in fiber, potassium, calcium, iron, and vitamins. Plantain Smart Mix is an excellent choice for diabetes management, weight loss, hypertension control, lowering bad cholesterol, fighting anemia, prevention and treatment of constipation, builds strong bones, improved mood and sound sleep. Available at everyday supermarkets, Market Square, and other major supermarkets and stores near you. You can visit our website www.cncsmartfoods.com for diet plan and consultation with dietitian. Call 0708 987 3467. CNC Smart Foods. Eat smart. Live well.